seeing the important. So the important translocations, and in case of the AML. So under AML, we are seeing, first we will see the T821. So under T821, we need to know a few things, that is the fusion gene, the FAB classification. So to get started, looking at the fusion gene. The fusion gene in case of the T821, firstly we need to know that this is the most common. And now looking at the fusion gene, it is a run. It is a run X1 as well as a run X1 T1. Run X1 and run X1 T1. And then looking at the FLAB classification. So FLAB classification, it is nothing but the blast with the maturation and M2. So it is a blast, and this is with the maturation as well as the M2. Next we are going to look at the clinical associations. So what are the clinical associations with the T821? So looking at the clinical associations, this includes, there is a myeloid sarcoma. There is myeloid sarcoma as well as there is chloroma. Myeloid sarcoma as well as the chloroma. Next we are looking at the prognosis. So what about the prognosis in case of T821? The prognosis is very good. Next we move on to the T1517. So in case of T1517, looking at the F fusion gene, that is FG, it is a PML. It is PML, RA, R alpha. And now moving on to the FAB classification. So what is the FAB classification? This is nothing but the acute. There is acute promyelocytic. So it is acute promyelocytic leukemia. Acute promyelocytic leukemia, and it is M3. Next, looking at the clinical association. So clinical association, it is DIC. Now we're looking at the prognosis. The prognosis of the T1517. So what is the prognosis of T1517? Prognosis is that it is very good. Then we move on to the T1616. So T1616, or it is known as the INV16. So here, what is the fusion gene? The fusion gene in case of T1517 was PML RARA alpha. So here it is the CBF beta, and this is nothing but the core binding protein. It is a core binding protein, binding factor. Now when we're looking at the FAB classification, so we look at the FAB classification. So under the FAB classification, this comes under there is myelomonocytic. There is myelomonocytic, that is M4. Next we look at the clinical association. So in terms of clinical association, it is the eosinophilia. It is eosinophilia. And what about the prognosis? Prognosis is, it is nothing but it is good. So this was about the important translocations in case of the AML. To learn and grow daily like this, please do subscribe.